webinar is also being recorded to ensure that those who weren't able to make it this evening can catch up another time. It will also be saved in the resource hub for vets on the Arwain DGC website. So I'm Marial Guttridge from Mentor a Busnes, and I work on the Arwain DGC project. And we also have Dr. Sean McCain, Equine Medical Consultant and Director at Cots Equine Hospital, who will shortly be presenting the training element of this webinar, covering antimicrobial resistance, antimicrobial stewardship and biosecurity. I'll start off by introducing the Arwain DGC project and the Equine Health Clinics in Wales. So Arwain DGC is a project funded by Welsh Government through the Rural Development Plan until June 2023. And it has been created as a response to the Welsh Government's 5-year implementation plan on AMR. The aim of the project is to support vets, farmers and equine owners in Wales to reduce the need for antimicrobials. There are 5 partners involved in the project, and they are Mentor a Busnes, Welsh Lamb and Beef Producers, Iechyd Da, Aberystwyth University and Bristol University. So this infographic gives you an idea of what each partner is doing in this project. So the Equine Health Clinics run by Mentor a Busnes is part of the Knowledge Exchange Programme for equine owners. A copy of this presentation and Dr. Sean McCain's presentation will be sent to you following the webinar. Therefore, I won't go into detail on what every partner is doing. So Arwain DGC will be offering equine health clinics to equine owners based in Wales. Therefore, if you have owners in England or anywhere beyond Wales, they are not eligible for support under this project. So please can you ensure that you only promote these clinics to equine owners based in Wales. These clinics are one-to-one advice and screening worth up to £250, excluding VAT for the vet practice. These clinics will focus on the horse's health and what preventative measures equine owners can take to ensure their horses stay healthy and reduce the risk of antimicrobial resistance. So the support available in these clinics are advice on biosecurity, advice on health planning, general health advice and checkup, and then it also covers culture and sensitivity testing. But please can you make sure that you do a clinical assessment before you do a culture and sensitivity test, as this is required in the report following the clinic. Dr. Sean McCain will go into more detail about these areas in his presentation, and the 2-sided A4 sheet has been created by Sean for you as local vets, and these can be used as a prompt during the Equine Health Clinic. So it's important really that you understand the terms and conditions of these clinics. Welsh Government want to encourage client-vet relationship, and therefore equine owners need to contact you as the local vet to express their interest in the Equine Health Clinic. And equine owners must be registered with Arwain DGC before the clinic takes place. The clinic must take place within 30 days of issue date, and there's a maximum of 1 clinic per equine owner. So for example, if you have a livery yard with 15 equine owners, each owner is eligible for a clinic, and therefore there's a potential for 15 clinics at that livery yard. The clinic can cover the advice and screening of more than 1 horse owned by that equine owner, and funding of up to 250, excluding VAT, is available per clinic to the vet practice. Any cost over £250 needs to be charged to the client, and funding is allocated on a first-come, first-served basis. And as I said earlier, the project is until June 2023. All of these terms and conditions are included in the flyer, and they will be sent out to each participating practice tomorrow and digitally tomorrow as well. So the process flow chart has been emailed to your practice, but again, I will send these again tomorrow. I think we just need to make sure that everyone understands the process before you start taking part in the clinics. So when an equine owner states to you as a vet practice that they're interested in an equine health clinic, or that you have identified suitable candidates who agreed to take part, then we need you to provide the name, address, email address and contact number so we can register them with Arwain DGC and raise a purchase order. Registration is short and simple. It takes a couple of minutes to complete. And once they're registered and a purchase order is created, we'll send you a purchase order confirmation form, and this will act as the approval for the clinic to go ahead. No clinics should take place before a purchase order has been issued. You as vets then need to complete the clinics within 30 days of the purchase order confirmation date and forward the invoice and report to Arwain DGC at mentorabusnes.co.uk. A report will need to be completed and submitted with the invoice for the work within 30 days of the purchase order confirmation date. The report template has been emailed to the practice, and again, I'll email them again tomorrow to you all. When you're out doing an equine health clinic, we would also really appreciate it if you could take some pictures so that we can use them on our website or quarterly bulletin. We're also looking for case studies during the year. So if you know of any examples of clients making any changes to their yard or practices following an equine health clinic, and we would really appreciate to hear about that. And we would also include your practice name when mentioning in the when creating the PR. And an evaluation form will be sent to the equine owner once the clinic is completed and the invoice and report is received. This is essential as part of an evaluation of the project services. So, diolch I chi am wrando a rhoi. Thank you for listening. Have you got any questions about the equine health clinics and their process? Yep. Okay.
Hi, sorry, I had a question. So do you have to have a clinical indication that a horse on that yard needs antibiotics?
Sorry, can you say that again?
Yeah, do you have to have like a clinical indication that a horse on that yard needs antibiotics? Or do you just kind of do these as a prophylactic to stop antibiotics being used?
So ideally, Welsh Government wanted to promote the biosecurity element of the clinics. So you don't necessarily need a client with an animal who's infected or sick. Anyone who wants to improve their biosecurity practices or health planning are encouraged to take part in these clinics.
Brilliant, thank you.
Okay, thank you. Any more questions? No. Right, I'll stop presenting now.